Is diabetes serious?
You bet it is.
Diabetes can lead to heart attack or stroke. Vision problems, including blindness. Nerve damage, tingling, numbness in feet or hands. Amputation. Kidney failure. Although diabetes can pose significant health risks, in many cases it can be controlled, especially if diagnosed early. Here are early warning signs of diabetes. There's an important substance in your system called glucose. Glucose is a type of sugar that's converted to energy in your cells. Insulin, produced by your body, enables glucose to enter your cells, providing useful energy. If your insulin level is low, insufficient glucose enters the cells, resulting in low energy levels. Under these conditions, the glucose level in your blood will be elevated, since the glucose is being blocked from entering your cells. Increased volume and frequency of urination is commonly one of the first symptoms you'll experience. You'll have an increase in volume along with the need to visit the bathroom more frequently, often at night. This increased frequency is often accompanied with an urgency to urinate upon short notice. As a result of the increased urination, high blood glucose causes dehydration. Mild dehydration might not be noticeable and may be dismissed as temporary increased thirst. This thirst is an early symptom of mild dehydration, and many times it's accompanied by a dry mouth, indicating glucose levels are too high. Increased hunger is another common symptom in early-stage diabetes. It is deeply associated with the reason why you feel low energy levels. You have a reflex system to maintain your balance and keep yourself healthy and vital. When your body detects there is not enough glucose in the cells and not enough energy, it would interpret this as if we were not eating properly, and triggers hunger as a defense mechanism to get more nutrients and energy. Visual problems can be caused by changes in the amount and concentration of liquid in different bodily tissues, including the eyes. In early stages of diabetes, high blood glucose affects the lens of the eye, a particular structure that changes its thickness according to the images we are viewing, to focus the image and get a clear view. When blood glucose is high, the lens starts absorbing fluid and swells, changing its thickness. Those with an early onset of diabetes typically experience blurry vision as the structure of the lens changes. This type of blurry vision is reversible when blood sugar levels go back to normal. But throughout the disease, it is possible to experience serious eye problems that might not go back to normal. Diabetes can also affect the retina, a special layer of the eye with nerve cells that transmit visual images to the brain. Blurry vision is a late manifestation of diabetes and one of the most common complications. During diabetes and even before the disease starts, you may see dark patches in the skin, mainly located in areas such as the neck, hands, fingers and other joint areas. These dark patches usually appear due to a reduced sensibility to insulin, and it might be used to detect diabetes and prediabetes. So, if you see dark patches in your skin and darker skin in your articulations, it would be a good idea to consult your doctor. Such a small symptom may turn out to be the leading sign for a doctor to diagnose and prevent diabetes. It may also help you detect the onset of diabetes and start treating your condition right away. People usually associate diabetes with obesity. Obesity leads to a condition which is basically insulin resistance and other risk factors. Insulin resistance places a heavy workload for your pancreas, and after a while, your pancreas wears down, and diabetes ensues. Once the damage is done, it's common to experience unexpected and speedy weight loss during diabetes. Since not enough insulin is liberated into the bloodstream, it will not be available to open up the gates for glucose to enter your cells. Fatty tissue continues to burn down, and there is insufficient glucose input to compensate. That's why people with diabetes start to lose weight, regardless of their diet and physical activity. As positive as this might seem, losing weight rapidly and without any reason is a sign we should look into, because not only diabetes is considered as a cause. Doctors would need to rule out other degenerative diseases, such as cancer and HIV. Slow healing is another common warning sign, and many people diagnosed with diabetes would first come to the doctor worried about slow wound healing, especially in the lower extremities. Diabetes causes alterations in many different body systems, including the circulation, and blood circulation is essential to speed up the healing process. Since circulation is impaired in diabetes, there is a reduction of the blood flow volume, and the healing process becomes more difficult and may further slow down because there are two associated factors, a systemic inflammation and a higher propensity to infections. All of these factors add up, and patients are likely to have slow healing wounds that get infected and become ulcers. Another body system that is commonly affected in diabetic patients is their immune function. Immune cells throughout the body reduce their normal function and circulation becomes impaired as well. This usually leads to a higher risk of infections in the skin, the gastrointestinal tract, the urinary tract, and the airways. Most women would also experience recurrent yeast infections, and this might be one of the only signs in senior ladies. While we're on the subject of diabetes, let me tell you about George. His story is absolutely amazing. George is just a regular guy, working for a living and enjoying life. He's a devoted family man and especially loves spending time with his grandchildren. George has worked hard all his life and was looking forward to a long, well-deserved and happy retirement. For George, life was good.
But then, suddenly and without warning, disaster struck.
While at work, George collapsed. A call was made to 911 and he was rushed to the hospital. Doctors determined that he had fallen into a diabetic coma. Panic overcame his family and friends. Would he ever come out of the coma? Would he even survive? Warning. This could happen to you, even if you have no signs of illness of any kind. Doctors determined that George would need to have surgery and would be facing amputation of his leg. His family was devastated. They feared that this would be just the first step and things would deteriorate even further. They prayed for George's recovery, but his future didn't look promising. If George was able to survive, he would likely be unable to care for himself and would be dependent upon others for day-to-day activities we all take for granted. He didn't want to be a burden to his family. As you can imagine, George was facing the biggest challenge of his life. Then, a miracle happened. Much to everyone's surprise, not only did George come out of the coma, he discovered how to reverse his issues and went on to enjoy a long, happy and healthy life. Watch the video of George's ordeal, how he dealt with it and how it may one day save your life. Discover the life-altering path that took George from the gloomy depths of hopelessness to a happy, healthy life for years to come. Click on the link shown in the description. It might just be a lifesaver for you. If you enjoyed this video, you know what to do. Go ahead. Smash that like button. And click subscribe, so you won't miss any new videos.